how do you engage the consumer patient when identifying innovation opportunities? So I know that some health systems have patient panels that they bring in, and some will include of patients in their innovation, sort of identifying the opportunities and checking the progress of different, especially mobile technologies and those kind of things. How do you engage the consumer patient in your innovation opportunities?
Yeah, I think those are all great ways of doing it. The one thing that you don't want to do is you don't want to take something that hasn't been tested yet and beyond like a proof of concept and bring that out to the market to be exposed, because that will look, that will not be a good representation. So for me, going through what I call it is kind of like a dimmer switch. You kind of get the idea, you turn it on, you start to get feedback, you keep fine tuning it, keep turning it up. But you can take that dimmer switch, and once you're ready to roll, you can flip it all the way on high. So that's not an issue. The issue is, how do you get from the current starting point to high? And I think in a methodical yet fast way, because whatever is innovative today for you, tomorrow somebody else is going to match it. You got to be on to the next thing. So once you get something there, you get it rolling, you got to be thinking 3 to 5 years ahead of what I want to be delivering. And then when the healthcare system or the physician market or whatever area that you're working in is ready to take advantage of it, you've already moved on to something else. It's up to them to change their processes to take advantage of it, to modify the people to be able to take advantage of it, and to bring all that together. So from a technology perspective, you've got to be several years out in advance. But when you look at your market and you look at your healthcare system, it's going to be up to them to accelerate and bring that out. So when you look at anything with the consumer, you only kind of get one shot. Once you kind of mess something up with somebody, they can move on to the next one, the next provider. So from that standpoint, I think you got to be careful, but boy, you got to be focused and you got to be fast.